Okay, recently you asked me about measuring the nuchal thickness and whether it was important, etc. So today I thought we'd go over my thoughts on this issue. The first and really most important thing is nuchal thickening important? And the answer is absolutely. Okay,
Right.
This is a finding that, in my opinion, is up there with finding congenital heart lesion in terms of worrisome finding in the world of potential diagnosis of the Down syndrome.
Right.
Okay, and as you know, you frequently hear the word soft marker for EIFs, myopylectasis, choreoplexis, short femur. But unlike those findings, nuchal thickening or absent nasal bone fall into a different category. And in the literature, you'll hear this referred to as hard markers, for example, instead of soft markers.
Right.
Well, there's really no question. The hard markers, like nuchal thickening and absent nasal bone, are extraordinarily important. I would highly recommend any patient like that to go on to an amniocentesis.
Okay.
So my issue is not with the importance of this finding that was described by Dr. Benasraf, one of our most astute observers, way back in the 80s. That is not my issue. My issue is that everybody measures it on the axial plane.
Right.
There's reasons to do that. It's easier in terms of just getting the image and making the a measurement.
Right.
But there are some definitive issues with the axial plane. So I think you would agree that that image here in the axial plane, looking at this, that looks too thick.
Yes.
If we measure this nuchal thickness, it looks thick, and it actually measures thick.
Okay.
Okay. Now, that is completely spurious.
You want to talk about the plane really quick? The appropriate.
I will,
Okay.
but I want to talk about that in a later slide.
Okay.
Okay. Here we have the same fetus in a mid-sagittal plane, so that you can look at the soft tissues in the nuchal region.
Right.
Now, clearly, here we see there's only a couple millimeters of tissue.
Mm-hmm.
If the plane moves down just slightly, just a slight angle change, the thickness increases a bit. Move down a bit further, the thickness increases a bit. But here's the real problem. If the beam goes through the foramen magnum, then all of a sudden you add a significant amount of soft tissue which isn't supposed to be included in the measurement.
Okay.
Now, here's the spurious measurement where the plane went through the foramen magnum.
Right.
So you're supposed to line up the cavum septi pellucidi, the third ventricle, the cerebellum and cisterna magna, and the occipital bone.
Right.
All right. So the occipital bone is supposed to be there. But in the axial plane, because of the physics of ultrasound and what's called a reflective shadow, here's the right measurement. But you see, it shadows out the bone.
Right.
And here again, you can see that these all look different. This is the bone. This is the skin. And you can see the bone is missing.
Right.
The bone is missing. Now, these are equally spurious measurements. Too thin.
Right.
Okay. So, there's always this issue on the axial plane. So, again, the important aspects are very slight angle changes in the axial plane can alter the measurement.
Right.
So before I call increased nuchal thickness, look, if the measurement is normal,
Right.
it's normal.
Right.
But I think it might be abnormal. I don't call that without checking it in a mid-sagittal plane. What constitutes an abnormal thickening? Well, again, this is something that comes up from time to time, even in lawsuits.
Okay.
Now, I've used 6 millimeters from 16 to 20 weeks. And Dr. Benasserif uses that. And if it's good enough for her, it's good enough for me.
Okay.
Okay. After 20 weeks, I don't use the nuchal thickness measurement. Some do, modifying it to some extent. I don't do it.
If you were to do it, how far into the...
I don't do it.
I know you don't, but on
Oh,
those who do...
they go up to 22. I think some even go up to 24 weeks.
Okay.
Now, some also recommend using 5 millimeters as the threshold.
Right.
And some recommend using 5 millimeters from 16 to 18 weeks. And then 18 to 20 weeks, you would use 6 millimeters.
Okay.
I don't do that.
Gotcha.
Okay.
Mm-hmm.
Now, why can I be so vehement in my own, keeping my own counsel? And that's because the AIUM guidelines don't require nuchal thickness measurements.
Okay.
Okay. Now, this is a very important thing if you're listening in about medical legal requirements. Even though the AIUM guidelines have a sentence that absolutely specifically says these are not meant to be the standard of care.
Mm-hmm.
I have been a witness in many trials, and it's always used as the standard of care.
Right.
Okay, so it's the standard of care. All right.
But having said that, if there's a picture on your scan of a nuchal thickness that is too thick,
and you didn't observe it,
yes, you're still going to be...
You still have some liability there.
Okay.
Okay. But here's the more important thing. Many institutions in their protocols or their sonographers make up their own protocol and commonly measure this thing.
Right.
If that's what you do, then you are required. Your own protocol supersedes the AIUM guidelines.
Okay.
Now, you are not allowed to write a protocol that is less stringent than the AIUM guidelines, but you can certainly write one that's more.
Right.
And if you do that, you better follow it because that's what the jury will be looking at as your standard. There's other reasons to look in the mid-sagittal plane, in my opinion, before you call the abnormal case, not the normal case.
Right.
Okay, and that's because here you can see that this fetus is in neutral position.
Right.
That's how the measurement should be taken. But this fetus extended its head.
Sure.
And therefore, that thickness, even though it's the same guy, it's going to be much thicker. Oh, and by the way, I forgot to mention, the appropriate place to measure it is that axial plane, lining up those structures, and right at the most distal part of the occipital bone that you can.
So if you're in the mid-sagittal plane, you want to go perpendicular to the bone at the lowest part of the
That's
bone.
right. You measure it right there, and you can see that it's thicker.
Right.
There.
Okay.
Okay. So, also, let's say you had a measurement of 6, and you really weren't sure it was right, so you checked here, and you found that the kid's head was not extended, but in fact flexed, and it was 6.
Yeah.
Okay, so then you would be more convinced. So it's very helpful in a variety of ways to visualize in this plane.
And just for helpful sake, let's say the fetus's head was extended the entire time.
Yeah, I would.
And it's over 6. How do you say, well, it looks thickened, however the head is extended, or
no.
What can you?
I would make the judgment that it's normal.
Okay.
I mean, unless it was like 10 or 12. We're going to get a little bit further into that on the next slide. Okay. Now, I'm a big believer in the look of things.
Mm-hmm.
All right? This fetus is our normal.
Yeah.
And this is a fetus with trisomy 21.
Okay.
And you can see this bulges outwardly.
Right.
Appreciate that?
Yes.
Okay, if I see that, I'm calling it. I don't need a measurement. I'm calling it.
Okay.
Okay. And so I think that's an important aspect of it. So remember, in fetuses with trisomy 21, you can still, even a fetus with trisomy 21, get very confusing thicknesses on the axial plane.
Mm-hmm.
But in the mid-sagittal plane, you'll see that that's greater than 6 millimeters, and you're good to go.
Can I ask you a quick
Sure.
question here? On these cases, what strategies, scanning-wise, do you use to to negate or improve your imaging of the bone back there? I mean, do you try and angle from different areas, or do you what tips or tricks can you give people?
Okay. There's a couple things I would say are useful. The one you mentioned is the most useful. Okay. The reason this happens is something called critical angle of reflection.
Okay.
All right. And that happens when the beam is simultaneously sampling two tissues of significantly different velocities.
Mm.
And of course, bone has the highest velocity, and so soft tissue is much less. And on a curved surface, when that happens, you reach an angle at which you don't see the bone anymore. It shadows out.
Right.
All right. Now, what you're doing is shadowing out the bone. So what would I do? I would measure from the edge of the shadow to the skin line.
Okay.
Because that's probably where the bone is.
Right.
Okay. And I also will just check it right there.
Okay.
You know what I mean? Just make sure. Check it right here. Measure that distance from the edge of that bone there. Remeasure here. See if there's any real difference. If you have confusion, by all means, go to the mid-sagittal plane and confirm one way or the other whether it's worth mentioning or not.
Okay.
Normal or troublesome.
And I think this will be hard to do without seeing my hand. But if your transducer is coming down like this, if you kind of slide it this way and angle back more like this,
Can any angulation
or
improves
angle
it.
in this way. Okay.
Yeah, any angulation improves it.
Okay. Thanks.
Sure.